of information. Quite a bit of information to cover tonight. My name is Chris Richards, and I'm a community educator with the Alzheimer's Association. So thank you everyone for being online tonight with us. And we're going to go through quite a bit of information in about 30 minutes and talk about just sort of an overview, an introduction to Alzheimer's and dementia and some details on the Alzheimer's Association. So I wanted to let you know just a few housekeeping details. Your attendance has been recorded. So when you logged in, it captured your name and your email address. So don't worry, we know you're here, and they will be able to follow up with you and email you. There are some frequently asked questions that are coming your way, so hold tight for that. So it's a new program, so I know there's a lot of questions about how it's all going to work out. So some details are coming. So in light of that, I still ask for you to hold questions. If you have questions, we'll save some time at the end for those. And it is likely I may not know the answer, but I will write down the question and forward it on. And again, some of those frequently asked questions will definitely help you out too to know what they are. So, okay, without further ado, we'll get started with our conversation tonight. So we're going to talk about the impact of Alzheimer's and dementia on our community. So I have some facts and figures to share with you, and I know we're in a virtual environment, but if just by a show of hands, if anyone here has someone in their personal, professional life, their family, or their friend group who has a diagnosis of dementia, if you could raise your hands. All right, some of you raised it on camera, some of you raised it. So often when I ask this question, it's almost everybody in the room. So the impact of dementia is staggering across our world, across our country. So I volunteer on behalf and in memory of my dad who had dementia, and I wanted to keep his memory alive, but also sort of pay the Alzheimer's Association back for all of the great support and resources that we used, my family used when we were working through this with my dad. So I can't say enough great things about the Alzheimer's Association and just the resources and support and all of the services, which we'll talk a little bit more about later. So thank you for sharing that. So one of the things that we know right now in 2024, more than 7 million Americans are living with Alzheimer's disease or another form of dementia. We also are seeing more than 11 million people who are providing unpaid care for people living with dementia, most often spouses and family members. And also of the dementia caregivers, and these are the unprofessional caregivers, 70% of them are feeling very stressed out with providing and coordinating care. And we also are seeing that dementia is one of the costliest conditions to society. But we can say that the Alzheimer's Association is leading the way to end Alzheimer's and all other forms of dementia around the world and in our community. So we're leading efforts with clinical trials, with medical research, with legislation in our local and federal legislature. So we're on it on all fronts and just providing research-based assistance and community boards and so many things for people out in the community that are working through a diagnosis and a journey with dementia in their own lives. Our mission as association is to lead the way to ending Alzheimer's and all other forms of dementia. We're accelerating global research, lots of promising research coming out, driving risk reduction and early detection, and maximizing quality care and support. Some of you might already know this, but this is something that comes up with a little bit of confusion about Alzheimer's. So dementia is the overall umbrella for the types of memory loss or other sorts of abilities, problems that creep in with dementia that interfere, that are severe enough to really interfere with our daily life. So it's a loss of memory or different behaviors, losing those abilities through dementia that really impact our daily life. And then under the umbrella of dementia are the different types of dementia. Alzheimer's is the most common, and it's thought that 60 to 80% of all forms of dementia are Alzheimer's disease. Second to that is vascular. Lewy body, my dad had Lewy body dementia, and initially he was diagnosed with Alzheimer's, and then we were able to get him into a Cleveland clinic, and they really honed it down to Lewy body disease, and we had no idea what that was, had never heard of it. So that's like the first time that I got on Alzheimer's Association webpage to try to find out what is this? What is it going to look like? What are we dealing with? What can we do? Other forms of dementia also include frontotemporal, other including Huntington's, and then some people are seeing a mixed dementia. So that's dementia that's from more than one cause. What is Alzheimer's? So it is a brain disease that causes problems with memory, thinking, and behavior. Symptoms eventually grow severe enough to interfere with daily tasks. It is progressive. It worsens over a number of years. In the early stages, generally memory loss is mild, but as the disease progresses, individuals will most likely need around-the-clock care. It is ultimately fatal, and in most cases, most individuals may find that they need to have care outside of the home. So it's not normal age-related decline, and how a dementia looks by person is just highly individualized. It looks very different from person to person, even the same types of dementia. And then in terms of how it progresses, how many years it might take for different people to hit different stages, it's really hard to predict because it is just so very different with how it looks with everyone out with everyone. We are seeing that there are some populations that are at higher risk. So Black Americans are about twice as likely as white Americans to have Alzheimer's or another form of dementia. Latinx Americans are 1.5 times as likely to have the disease as white Americans, and almost 2/3 of Americans living with Alzheimer's are women. So they research is showing that members of underrepresented populations, underrepresented populations are more likely to not seek care. So may have some barriers to healthcare, are less likely to participate in clinical studies, and generally won't get a diagnosis or the care that they need. So there are a lot of barriers in our country due to socioeconomic status and underrepresented categories when it comes to healthcare in general. So certainly when we're dealing with dementia as well. The impact of Alzheimer's and other forms of dementias on families is incredibly overwhelming. So caring for someone living with Alzheimer's can take a very dramatic physical, emotional, social, and financial toll on families. So we see that approximately 2/3 of caregivers are women, and over 1/3 of dementia caregivers are daughters. 83% of the health provided to older adults in the US comes from family members, friends, or other unpaid caregivers. And if you can put a dollar amount on this care, which we can, it's at over $271 billion. So that's an amazing, expensive and valuable level of care that's being provided for people who aren't professionals, who haven't had training, that are doing the best that they can. And in a lot of cases where you're seeing, for example, if 1/3 of dementia caregivers are daughters, they're probably working. So in my family, when my dad was on his journey with dementia, thankfully my kids were already in college, but my sister's kids were still at home. So we were all tackling this, my sister, my mom, and I together. And it took all three of us, to navigate and advocate for my dad. There was just a lot of considerations. The lifetime cost of caring for someone with dementia is also incredibly high and staggering. 70% is borne by families. So those costs are coming in the form of out-of-pocket health and long-term care expenses, or just from the value of the unpaid care alone. And then compared with caregivers of people without dementia, twice as many caregivers of those with dementia indicate substantial stress, emotional, financial, and physical difficulties. So, where we can, the Alzheimer's Association is really, really helpful for caregivers, for spouses, for family members. And I totally relate to that because, I mean, of course, everyone has heard of dementia or has some knowledge of it or awareness of it, but certainly when you get the diagnosis in your family, when you weren't expecting it, or even if you were expecting it, it's such a blindsided moment that it's so overwhelming. You don't know where to start. You've just felt so overwhelmed and just at a loss. And so thankfully, the Alzheimer's Association was there for my family. It was a really great place to get started. This has to be the top question that I get asked is, how do you know it's dementia? Or what are the things that we should be worried about? And I mean, I want to preface this by saying I'm not a doctor, and so I'm not an expert, but I do feel if there's something coming up in your life, in someone that you work with, a loved one, a spouse, a friend, you definitely should consider seeing a doctor. So if it's not dementia, you can rule it out. If it is dementia, you can know, get a diagnosis. There are some treatments, and we'll talk about that. But I do think that it's better to know. We are living in a treatment era, so we do have some treatments, and also it's good to know, and you can make plans accordingly. So, but most of the things that you're seeing when you're seeing warning signs of dementia are really significant. So generally, it's just something that's very different from how the person was before. So, and these are the 10 sort of overall overreaching concepts. So, memory loss that disrupts daily life. It might be driving somewhere and completely forgetting how to get there, someplace that's easy that you've always been able to do or they've been able to do. Challenges in planning or solving problems. Difficulty completing familiar tasks, confusion with time or place, trouble understanding visual images and spatial relationships, where we see a lot of things happening with our car and bumping into things, new problems with words in speaking or writing, misplacing things and losing the ability to retrace our steps. This isn't just your normal, I forgot where I set my phone down, where are my keys kind of a thing. Decreased or poor judgment, withdrawing from work or social activities, or changes in mood and personality. So with my dad was very handy, and he was supposed to be putting a new deadbolt on a exterior door in their home. And so he worked on this task for a long while. And then he came and told my mom that he was all done. And when she went to look, he'd put two handles on top of each other. So she thought he was joking. And so she laughed because she thought it was a practical joke. He was always a practical joker. And he didn't understand what was funny. He didn't see what was wrong. And actually, he got kind of mad about it. So that was a giant red flag that something was really different. Something was going on with my dad. So thankfully, my mom just made him a doctor's appointment and took him. Unfortunately, she didn't tell him why. And so he was a little blindsided by when she told the doctor in front of him, I'm really concerned about Dave. He's not himself. So he was kind of upset about that. But overall, we were just really grateful that she got him to the doctor. We were able to get a diagnosis, and so we could move forward as a family. So talking about the importance of early detection. So it's not like it used to be, and people sometimes still fall into the mindset, well, why bother knowing when you can't do anything about it? So that's no longer true. We can do things about it. Also, there could be other things that cause dementia-like symptoms. So you could have a medication that's causing a problem. You could have a thyroid issue, a vitamin deficiency. So you can have other health issues that sort of look like dementia, and it would be helpful to rule those out rather than just sort of give up and just try to live with it. So always paying attention to any changes in memory, thinking, or behavior that you notice in yourself or someone else. And those can be tough conversations for sure. I know that my dad was still working, and he was a manager, and people who were working for him had noticed a few things, but they just didn't know what to say or how to say it. So those kind of just nobody really said anything until my mom noticed. So, but if you do see changes that are new or unusual, definitely take action by having a conversation with a doctor or a trusted family member or a friend. And sometimes it's just having that sort of tough one-on-one conversation with the person. It's like, I've noticed a few things that really concern me. I'm worried about you. Have you also noticed things? So, and I do know Medicare will pay for annually a cognitive assessment. And so that can be sort of an easy thing to say, let's incorporate that as part of a wellness visit. And then, as I mentioned, there's a number of benefits to that early diagnosis. So you can plan for your future. We all have to plan for our future. Unfortunately, we all are going to die. And so we'll need to plan our paperwork, get our affairs in order. So universally, it's something that we all should do. But when you have a dementia diagnosis, you for sure are going to need your will, your trust, your powers of attorney, your advanced directives. So all of those things need to be taken care of. So you're going to explore treatment options. We'll discuss later, there are some FDA approved treatments that are showing promise in slowing down the progression of dementia. You can participate in clinical studies. So the association sponsors clinical studies. They help match people with studies. You can actually participate as a person who's not been diagnosed or early stages or at any point. They'll take healthy people who have already been diagnosed. And the association also will provide some resources and financial assistance if it's someone who qualifies for a clinical study, but they need to travel somewhere and need lodging or travel financial assistance. So something to keep in mind. And you do want to, of course, involve the person with dementia in important decisions about decision making and future care. And these are incredibly tough conversations. And I found that the information on the website was really helpful in navigating those conversations in my family. So I'm a retired HR lady, so I guess I'm used to having awkward conversations with people. So, but I really appreciated like the checklist or the outline of what we need to talk about, and I could blame it on the paperwork, but we needed to have these conversations, and it came in handy later in the end stages with my dad where he couldn't communicate anymore and he couldn't weigh in, and we already knew what his wishes were because we already had those conversations. And as difficult as those conversations and those forks in the road were, at least we knew what his wishes were because we'd already had that conversation. Treatments for Alzheimer's. So there's no cure yet. And then we're in the treatment era, but there are treatments that can change the progression. And there are also drug and non-drug options that might help treat symptoms such as memory loss and confusion. So treatments are administered different ways. And because everyone experiences dementia differently, treatments work in varying degrees. And they're not effective for everyone. They might be used in differing combinations. So my dad had Lewy body with some Parkinson's symptoms. So there was his doctor was always balancing his cognitive, his anxiety versus his physical abilities. So there was always some adjustments being made as we went along. So you do want to ask your doctor to learn more about treatment options. There are people, medical professionals who specialize in dealing with whether it's neurology or someone who might be more of a geriatric expert. So you do want to encourage caregivers and people who are dealing with a diagnosis to strongly advocate for themselves and find people who will help treat them and track down a treatment plan. And on the website, alz.org/treatments, you can find more details on these. There are several risk factors for cognitive decline in dementia. So some of them we can't control, such as age. So age really is the biggest risk factor. And once we hit the age of 65, it just continues to increase as we get older. So it's not genetics, it's age that's the biggest risk factor. But there are some things that we can control, and research is showing some promise. And it's really understanding that link between our heart health and our brain health. So anything that we're doing to be healthier, have our heart be healthier is going to be good for our brain. So it'll help us sort of stave off our cognitive decline and hopefully and possibly dementia. So, I mean, a healthy diet's not necessarily going to prevent us from getting dementia, but we can pay attention and make ourselves as strong as possible. So, and it's never too late to start making healthier choices for brain health. So the way that we can take charge of our brain health, a couple of things, staying in school. So you're all taking classes right now. This is a class, you're continuing education. So challenging your mind, staying in school. So they show that any sort of education is very beneficial, but the more formalized it is, even better. So I know that you'll be taking this course or this course, and then you'll be taking an exam. It's great for your brain health. Also get moving, eating right, maintaining a healthy weight, really important. As we talked about, that healthy heart, healthy brain connection, controlling blood pressure, managing diabetes, protecting your head, yes, always, getting good sleep, and being smoke free. So none of it, a lot of that's not a complicated, it's sort of a things that we should all be doing, but it is really interesting to note the brain and heart connection. So Alzheimer's Association is making a difference in our community. And here is just some of the ways that we help. I know I mentioned a few earlier. So I think the number one thing, and I have this in my cell phone, so I recommend that you all put this in your cell phone because I think this is the number one thing I share with people because it's absolutely the easiest and best place to start, no matter what your question is, what your need is, what time of the day it is. It's a 24/7 helpline. It's staffed by master's level clinicians, free of charge, confidential, 24/7, anytime you can call this 1-800 number, and that person on the other end of the line will help you no matter what you need. So whether it's the person that you're caring for in your home is sundowning and you're at the absolute end of your patience and you're not sure what to do and you don't want to call someone else, it's 11 o'clock at night, you can call the helpline. Or maybe you have a loved one who has dementia that doesn't live in the same city as you and you're not even sure where to start trying to find resources for them, call the helpline. Always available. And then the website has so much information. It's almost overwhelming, but free education and support there. So definitely dementia aging related resources, support groups, community boards, as I mentioned, checklists, estate planning, clinical trials. I mean, everything is on there. So my family really benefited from some of the research-based articles that were on there when we were making decisions. I mean, initially it was just like, what is Lewy body? What does that look like? How is it different from other forms of dementia? What can we expect? And then the community, the message boards, people were sharing their experiences, either them or themselves or their loved ones with different forms of dementia. And that was really helpful to just like understand kind of what we were up against and what it could look like for my dad, because we just had no idea. And then towards the end of his life, when we were looking at hospice and do we continue with a feeding tube? So those questions are just overwhelming. And we were able to go to alz.org and find information that really helped us guide our decision making. And you can always do any level of participation with the Alzheimer's Association. So these are just some of our fundraisers that we do. We do have each year the Walk to End Alzheimer's. So that is a very powerful event. You see the women holding the different color flowers. So each color of flower represents something different, whether you yourself are living with dementia, you are supporting a loved one who is, you've lost a loved one who is, or you're just advocating to end Alzheimer's. So it's a really, I've done the walk a couple of times, and this last year I was able to go to Southern California where my kids live and walk with them and their loved ones. And it was very powerful just to keep my dad's memory alive and be supportive and raise money for the cause to find a cure someday and just put an end to this. How you can help. So yeah, I know you're all healthcare professionals, so you are helping. So thank you. Thank you for what you're doing. And thank you for bringing this knowledge and using this knowledge to help and support people. So you can always help by sharing your personal story as an advocate, providing education or a support group, getting involved in clinical trials or a research study, or signing up for a fundraising program. You can work with your work group or your organization or your business to do that. And I certainly welcome you to share the hotline with everybody. So I come across people in my friend group, and then just as I'm out in the world who are dealing with and living with dementia, Alzheimer's, or someone in their family constantly. So, and they don't even know I'm a volunteer with Alzheimer's Association. So I'm like, hey, I have a phone number for you. I have a pamphlet for you. So I'm sure they're like, oh gosh, who am I running into now? But so much information on there. So I have really just rattled through that pretty quickly because I wanted to, in the interest of time, get through everything and get to the end. But thank you so much for joining this presentation today. And I wanted to just take a few minutes. I don't see anything in chat. Thank you all again. And again, we do have you all recorded. We know that you're here. We have your email. But any questions or comments before we close out tonight? Does Lewy body dementia have the same age of onset? Great question. So it just is so vastly different. So no, all dementias can occur. It's just so different for everybody. So my dad, and there are some, like, if I think if it comes on before the age of 65, it's early onset of whatever dementia that is. My dad was diagnosed, or he had some symptoms that were starting to be noticeable when he was 67. And he lived with disease for about 9 years. So he was otherwise very healthy, and so lived quite a while. And it's very lucid in the beginning and conversations that we could have. So good question. It's one of the things that really frustrates all of us with dementia is that it's really hard to know how to look. the timing of how we'll progress through the phases. Because I have people ask me, well, when? Oh, thank you for clarifying. Under 65 is early onset. Okay. Yeah, so it looks different for everybody. I've had people in my workshop say, well, at what age will they not be able to drive? It's like, well, that's just so difficult. It's so hard to say. So great question. Thanks for sharing. Has anyone found linking diabetes and dementia? I don't know about very specifically those two things, but anytime, that any health issues that can have a risk, and the heart health is really important. Um, how much of a factor is genetics? So genetics is a factor, but age is the top factor, surprisingly. So early onset is early stage. Thank you. I know the stages are kind of interesting too. Generally, there's early, middle, and end stage for dementia. And again, it's highly variable between person. And roughly by the time that we're seeing some symptoms with people that we're noticing, if we're not a caregiver, they're probably already in the middle. So those with diabetes do have a higher risk for dementia. Perfect. Thanks for sharing. Any other questions, comments, things you want to share? All right, perfect. Thank you, everybody. And thanks for sharing the information that you have. That's what makes this all work, is us helping each other, supporting each other, giving each other information, encouragement, and love. So thank you so much. Thank you for what you're doing.
Thank you, Chris.
Thank you very much.